Have you ever noticed the pace in a dental practice? It's fast, right? I mean, think about it. We want to schedule our patients back to back to back. We want the phone ringing off the hook. We would like to see our patients checking in, checking out, turning our rooms around. It's busy, and that's good. That's where the good stuff is at. But this pace can create blind spots and leave us vulnerable if we don't stop, slow down to communicate, calibrate, and connect. I'd like to tell you a little bit about how I came to that conclusion. You see, this is young Sam, pre-wrinkle Sam. I had just started my brand new job at a dental practice and I was so excited. This was my career. I was going to make the best of it. And so when the doctor hired me and asked me if in 3 short weeks I would be ready to cover the practice while the rest of the team and him went on vacation, I was invigorated. I said, heck yeah, I got this, doc. You go to the beach. I'll stay here and hold the fort down. I thought I could handle it. No worries, right? I mean, what could possibly happen? And then my wake-up call literally came in. It sounded a little something like this. Free State Dental, this is Samantha. How may I help you? Samantha, there's blood everywhere. Did you say blood? Yes, I don't know what to do. There's blood everywhere. Okay. Well, what happened? And who is this? This is Mrs. Smith and my boys, they were out back, they were playing, and Timmy, he caught a baseball to the face and there's blood everywhere and his tooth, it's on the ground. Okay, so there's blood everywhere and there's a tooth on the ground? What? Okay. This is what she's telling me, and honestly, this is what I'm imagining. And then the dreaded question came in. Samantha, what should I do? When should I come in? What should she do? When should she come in? I have no idea. I just started 3 weeks ago. I don't even know at this point why they hired me. I know nothing. Mrs. Smith, I'm gonna need to call somebody. Just go ahead and just come in and I'll call somebody. Bye. What was that? In this moment, I had no way to help this poor woman, and I felt awful. All I wanted to do was be her superhero, and I was the furthest thing from that. I could not help her by answering any of her questions. It wasn't there for me. So what did I do? On Monday morning, I pulled the doctor aside and I told him all about that phone call. I admitted that I was ashamed of how I handled it and that I was disappointed with the way that I represented the practice. And I told him transparently, I'm not sure if I'm the right one for the job, doc. And he patted me on the back with empathy and said, don't worry about it, Sam. We'll sit down at lunch and talk through that, and I'll take care of Timmy when he comes back today. And we did just that. We sat down at lunch and he started to draw pictures for me and show me what the implications of trauma to a tooth looked like. It was fascinating. I really enjoyed this conversation because I started to understand how I could have showed up differently in that conversation on the phone with Timmy's mom. And I got a little bit curious from there about all the other things that I was talking to patients about. So week after week, I would bug him for some of his time to sit down and talk through some of these other cases that we were seeing come through our practice, the phone calls that I was taking. I wanted to know more. I felt more equipped after that conversation about Timmy's case, and so I wanted to know how I could be more equipped with other patients that were coming into my orbit. As we started to do this, the team started to take notice. They started to engage. I mean, we were doing this around the lunch table, so everybody was there listening, and instead of scrolling through Facebook, they started participating in the conversation as well. We recognized an opportunity to start a structured meeting, and we did. With the permission of the doctor, we started scheduling about 30 minutes over a lunch hour once a month where we would start to discuss cases of a patient. We called it our internal study club. It was awesome. We would pick a case from a week or a day that we had a patient come in that was interesting, or maybe something that we would do on a regular basis. And we would bring everything but the kitchen sink to that meeting that pertained to that particular case. We would have x-rays, intraoral photos, clinical notes, instruments, models, impressions, you name it. If it was part of that treatment plan, it would show up in our meeting. And what would happen is our doctor would stand up, he would become our teacher, he would point to the x-rays, he would show us what he saw and ask us, what did we see? This brought forth so much interesting conversation that we were learning so deeply and understanding exactly what was happening in the operatories while we were sitting up at our desks. It was awesome. It became a regular thing for us where we were also calibrating our language to what the doctor would say, and that would build out this amazing trusting space with us and our patients. The doctor would tell us exactly what he would say in that diagnostic conversation with the patient. This gave us the opportunity to match our words with his. If he was saying swelling, we were saying swelling. If he was saying inflammation, we were saying inflammation. This gave the patient the opportunity to hear those key things about their condition over and over and over again. He would even dive into the chart notes. He would tell us what he meant about the words that he was writing, the written dialogue, in the patient's chart. It was incredible. We were able to really calibrate and understand deeply what was happening with that particular treatment. As we would wrap up these meetings, my favorite part of the whole meeting was the Q&A session of that. We would open up the room to anybody on the team who had a curiosity about something. We would try to unravel all the things that we were still curious about or still didn't quite understand so that we could find the most deepest space of alignment around the treatment and the diagnosis that our doctor would give on a regular basis in the operatory. It was phenomenal. The best part about all of this is the outcomes. We started noticing case acceptance rising. The case acceptance rate was going through the roof. 5-star reviews, they were climbing. Patients were seeing and feeling our on-site expert experience every time they came in, and they were telling other people about it. We were efficient and firing on all cylinders. We truly understood what was happening back there, so it allowed us to behave differently in each of our departments. We also noticed our schedule changing. It was becoming full and consistent. It was awesome. And the best part about all of this is that our team, they felt so empowered. They were getting smarter and smarter after each meeting, that they felt empowered and confident to have conversations outside of the treatment conversation with our patients. It was wonderful. I know that today, if I had the chance to talk to Mrs. Smith again, it would sound a lot different. It would sound a little something like this. Mrs. Smith, everything is going to be okay. I understand and I'm with you. I want you to take a piece of gauze and place it where the bleeding is happening and apply a slight bit of pressure. Then I want you to take the tooth, put it in a glass of milk so we can keep that tooth hydrated, and I want you and Timmy to head straight on over here to the practice. I'm going to be here waiting for you, and the doctor on call will be here to take care of Timmy. And Mrs. Smith, I assure you, there are many ways to fix a missing tooth, so no matter what, Timmy's going to be just fine. That's how it would sound. And after a call like that, I would feel like her superhero. And that's exactly what we want. We want to be able to meet our patients where they are. And if we implement an internal study club, I promise you, you will start to build stronger teams and on-site experts. Give it a try. You got this.